Integrating multi-model pharmacological gold standards into the approach of recovery. Brandon T. Harmison. Human Services. HUMS 133, Pharmacology. Dr. Wilbur. Due, May 16, 2026, 11:59 p.m. Introduction.
Methamphetamine, meth, is a powerful psychostimulant that requires a powerful treatment solution. To undo the disruption of abnormal dopaminergic signaling from the use of methamphetamine, and the abnormal reversing of protein transport that depletes the synaptic vesicles, the integration of a multi-modeled pharmacological gold standard such as naltrexone and counseling will aid. This treatment is done by establishing a normal baseline for practitioners to effectively treat. The pervasiveness of addiction no longer holds power over the user with counsel. Methamphetamines does affect the body in various ways. Primary point of interest is within the nucleus accumbens. Simultaneous integration of medication within the windows of administration, distribution, metabolism, and elimination will collectively create a gold standard within treating addiction. Addressing the ongoing argument that the concern is medications, and counseling may not be influential when treating addiction. This article contends that a polished functioning nuance approach can fundamentally increase the rate of treatment that does not end in relapse. Contemplation within the mind of the user to end the cycle of addiction must first begin with the unwavering notion that addiction is not a disease, instead it is a consecutive repetitive action. Establishing these fundamentals within the user will aid in the growth of prosperity for all mankind, not just for Americans. The technicalities within the presumption of the disease model has had its pervasiveness for too long and must be nullified. The treatment model that is being presented is only a concept of the possibilities that with the change of the understanding of addiction, longevity can occur. To prioritize treatment with naltrexone, and counseling that will directly affect the system of ADME will be the creed of this paper.
Part 1: Absorption. The first stage to address this problem of meth addiction is to establish a pre-treatment program for the addict with naltrexone, as shown in Figure 1.
Importantly, the primary purpose of naltrexone is to blockade opioid receptors. This also applies to endorphins. By this action, the secondary modulation of this blockade of dopaminergic-driven neurons is to reduce stimulatory sensation of substances.
Figure 1. Naltrexone pre-treatment program, Stage 1: Absorption. Part 2: Distribution. To expand and introduce Figure 2 that depicts the effect of methamphetamine at the site with the role of naltrexone in treatment. The long-acting antagonist that is naltrexone functions as an inhibitory agent. Methamphetamine having a primarily increases in the release of dopamine renders itself less effective for stimulation. Naltrexone given prior into the bloodstream will modulate the mesolimbic dopamine pathway.
By providing a temporary blockage, the naltrexone pre-treatment program can reduce reinforcement stimuli and craving to use.
Part 3: Metabolism.
Through the process of metabolism, naltrexone and methamphetamine, meth, do not chemically bind to each other to be metabolized. The human body metabolizes each compound through independent, separate pathways. To fully understand the process of the medication naltrexone to be metabolized must be separated into two different categories of administration. The first is the oral route of absorption of naltrexone that typically metabolizes and clears the system within 24 to 48 hours max. The other is the extended release injection named Vivitrol that lasts 1 month or more. Meth, despite the route of administration, this drug remains in the system for considerable long duration. The bloodstream 3 days, saliva 4 days, urine 5 to 7 days, the hair 90 days. The body metabolizes each compound through independent, separate pathways. Meth and naltrexone do not intersect with each other. The diagram is split into two independent pathways that show how each drug is processed by the liver metabolism. This diagram is Figure 3 that is split into two separate breakdowns of the substance meth and naltrexone. This is an important note that will aid in the comprehension to understand the process of metabolism.
Figure 3. Comparative metabolism pathways: methamphetamine versus naltrexone. Part 4: Elimination. The function of excretion by the kidneys is elimination through the final stage of the ADME sequence, excretion. Figure 4 illustrates the biological filtration plant that is the kidneys.
Figure 4 is the depiction of how the kidney handles the leftovers of both the stimulant meth and the medication naltrexone. Within this process, the body eliminates both at the same time. Despite the pressing of both being eliminated by the kidneys, naltrexone doesn't interfere with how fast meth leaves your system.
Figure 4.
Figure 4 shows how the kidney eliminates the substance and the drug meth.
Kidney excretion elimination pathway for meth and naltrexone. Counseling.
According to the American Society of Addiction Medication, counseling is based on the level of care and the phase of treatment.
Early recovery from illicit substances such as meth, users will require counsel during and after treatment.
Early recovery involves crashing, intense cravings, and in many cases depression. During this treatment, with counselors should be familiar with withdrawal support. Meth withdrawal can last up to 5 weeks or longer. Overconfidence should be avoided by said recovering addict. The importance of a clear goal to stay grounded and realistic is essential, especially over long periods of exposure. After stabilization, said individual should maintain and participate in outpatient maintenance program. Treatment should be ongoing with positive reinforcement like providing drug-free tests. Conclusion. Integrating multimodal pharmacological gold standards into the approach of recovery is an ongoing pursuit. Ultimately, abstinence from methamphetamines is the sure way to stop the disruption of abnormal dopaminergic signaling from the use, and the abnormal reversing of protein transport that depletes the synaptic vesicles. The powerful medication that is naltrexone, and the companionship of a seasoned counselor will provide fortification in treatment for recovery of the psychostimulant that is meth.
Reference.